advancing health equity. So we can get started with the slides, Miss Chrissy. All righty. So that is our title, Community Health Workers, our role in advancing health equity. So by show of hands, can let hold on, I had a little oops on my computer. How many of you know what community health workers do by show of hands? Okay. All righty. Okay. All righty. All righty. Good synopsis. Okay. So community health workers, we are important. And this is my baby. This is my life. This is my career as I'm going into retiring age appropriate. I'll be turning 50 this year. So I'm going into that age where I'm settling down because my career started off with child protection and DCFS, and it's dwindling on down to where I'm just love working with people and being out and being helpful. Let me say it like that, being helpful. So, as community health workers, we are in the front line. We are connecting, we are helping, we are providing, we are serving, we're linking, we are doing all types of work to advocating for poor, for the rich, for whomever needs health equity as well as social justice, and we can help with healthcare organizations improve their care quality. Next slide. CHWs offer interpretations. We translate. Like I said, we provide culturally appropriate health education. We inform. We get people what they need. We inform. We give informal counseling. We are guided. We are guiders. We advocate for individuals, for the community. We talk. We provide. We do anything that requires helping others in this community to get whatever they need to um, be better for themselves, for their family, emotionally, mentally, physically, spiritually, as well as socially. Next slide. Community health workers are usually on the front line, as you know. We do outreach. We help members of marginalized communities access health care if they need something, from being a patient of high risk to having services within for nursing mothers to the elderly to children. Whatever they need, we make sure that they get it. We make sure we connect them. We make sure if I'm vendoring a table at a certain event, I make sure that they get a resource, a number, or I will get back to them and let them know, look, this is what you need for this particular issue, and this is going to get you to your next step. We provide health education. We advocate, as I said before. We promote participant of empowering the community through communication, through organizations, and through just linking and being peers and supervisors to communicate openly and respectfully to all that we help. We also provide case management. Next slide. Why is it important to improve community health? Well, according to the Office of Disease Prevention and Health Promotion, the health of the community affects the quality of life of its members. So the community health can impact the quality of life, the educational achievement, crime rates, as well as life expectancy. Next slide. Living in unhealthy communities can lead to chronic disease, such as cancers, diabetes, and heart disease. When individuals are healthy, they can fully participate in and contribute to society. Please feel free to stop me if you have any questions or you want to elaborate on something or share something. Community health workers focus on preventing diseases and controlling the spread of infections. Examples of interventions include immunization campaigns, health education, regular screenings, as well as community health can also help reduce inequality among their residents. It can help to reduce health gaps, caused by differences in race and ethnicity, location, social status, income, and other factors that can affect the health. Working in the community level, working on the community level really promotes healthy living, helps prevent chronic diseases, and brings the greatest health benefits to the greatest number of people in need. And that's per the CDC. Next slide. Why are community health workers important to achieving better health outcomes in the communities? They improve access, they improve quality, they improve communication, they identify health disparities, and they improve understanding. And that means the understanding part is making the constituents or your community understand why having a good quality life filled with good health or promoting self good health give the community the empowerment that they need. Next slide. Why are community health workers important? Continue. Improve coordination, reduce social isolation, manage care, act as a liaison, reduce provider burden, and build connections. Next slide. Public health practitioners can collaborate with CHWs individually, in coalitions, and in healthcare teams to enhance the coordination of care within the healthcare system and social services. Collaborating with CHWs will improve the delivery of prevention and related services and links patients to community resources. This is an assessment tool that I use because this is how it usually happens within the community. When we're doing community events, this is pretty much who is doing what. You have a health monitor or some type of doctor or nurse or some booth offering that service. You have some diagnoses and investigations going on. If you link them to the service, you inform, you educate and empower, you mobilize community partnerships, which means it's going to be an ongoing link or ongoing partnership throughout. You develop policies because you're talking to each other and you bring in new ideas, fresh ideas between professionals or between agencies. You enforce some laws, you link services, and you assure competent workforce. And at the end of the day, pretty much whatever you're doing, you evaluate the situation and see if what can be done better, or if the work that you're providing or doing is getting the needs met of the community. Next slide. These are some of the titles that CHWs are named. They are patient navigators, they're ambassadors, they're self-management coaches, they're outreach educators or workers, they're peer health advisors or promoters, they're peer leaders or counselors. So they can be whatever, they can be just an encouraging person. And as for me, this is my title with Well Ahead, Community Engagement Specialist. Next slide. So according to Tulane, School of Public Health, the public health workers' goal in the community-focused care is to enhance healthcare services and patient outcomes in targeted populations by applying public health theory on a local, personalized level. Community health providers can cater services to a specific demographic and bring a sense of wellness to communities that would otherwise lack proper access of care. And that's according to Tulane University. This right here is a flyer that um, was put together by an event that I did last year, really. And that was when I was a health disparity social worker through BCP. And these are the type of things that we put together and make sure that it's in the least of areas that has lack of resources. So East Feliciana is one of those areas in Region 2 that lacks services and healthcare or any other type of resources. So Community health programs address disparities by ensuring equitable access to health resources. So those are that's one of the things about being involved in vendoring, as well as putting together um, community health events. Next slide. So I'm not going to go into all of these right here, but partnering with community health workers to enhance the coordination of care, public health practitioners in collaboration with community health workers can improve some of the health outcomes by providing support and counseling, addressing barriers and increasing use of services, establishing connections and providing education and strengthening care. Next slide. The Health and Human Services Action Plan to Reduce Racial and Ethnic Health Disparities shows shows support for CHWs, particularly in diverse and underserved communities. So by partnering with CHWs, you provide culturally appropriate community health education, promote awareness and understanding, mediate healthcare between providers and the community, educate healthcare providers about the health needs of the community and the cultural relevancy of intervention, improve cultural competency within the healthcare system, strengthen communication skills of providers and healthcare system administrators. Next slide. So in summary, transforming communities to support and improve their health and equality of life is important function of public health and the healthcare system. CHWs can be a valuable resource for public health practitioners to increase the effectiveness of efforts in clinical and community preventive services. The services that CHWs provide vary from community to community. They may be volunteers or trained full-time employees whose goals are to enhance the coordination of care and advance health equality in underserved communities. CHWs foster linkage between the community and the healthcare and social services systems to provide underserved populations with increased access to culturally competent services. Integrating CHWs into healthcare teams is a proven option or public health practitioners to consider when working with underserved communities. And that's my presentation. Any questions? Those are some of the references I used as well. So for the information.